Hey everyone. So, as you know, a few weeks ago, I said that I'd like to expand the When I Grow Up initiative. Already, we've had 21 amazing young people take part, sharing their future ambitions of what they want to be when they grow up. Part of expanding this initiative is that I'm going to be conducting a series of interviews asking different people from different professions and different fields about what their career entails and about what they wanted to be when they grow up, perhaps to inspire other young people uh, when they are pursuing their future careers. So I'm joined here today by Amy, who is a senior sister critical care nurse. Did I get that correct?
You have, yes.
All right. So just before I ask you my first question, do you mind just briefly explaining what your job entails, perhaps on a normal day, and whether that's changed during the pandemic?
Right, yes. My job is in the local hospital, and I'm in a intensive care unit. Um, so at my level, there's different parts to my role. Um, but the thing that I mainly do is training and development within critical care. Um, but for the guys that I work with that are nursing the patients more hands-on than I am, it has definitely changed throughout the pandemic. Even though the care is the same, the way we have to deal with things is slightly different. So obviously there's a lot of PPE that's needed to keep ourselves safe when we're dealing with the patients. Um, and the biggest thing for us is the fact that at the moment there's no visitors in the hospital, there's no family with these patients. And for being in critical care, that's very different because usually there's an awful lot of family around the patients, and at the moment there just can't be for their own safety. Um, and that's really challenging for us as nurses.
All right. Yes. Of course. Obviously, we've been hearing about the talk about PPE and the debate that's been going on uh, regarding the government claims to have enough PPE, but clearly, as you've said, and as many other nurses have said as well, there's just isn't doesn't seem to be enough to go around. But what I also want to ask is, uh, did you always envision when you were younger that you would pursue this career, or perhaps was there something different that you wanted to be, or did you always think that you were going to be in the medical field?
Yeah, I always wanted to go into nursing. My mum was a nurse, and that's what inspired me. She's still nursing. She's my role model.
Uh,
Um, and all of my mum's friends, well, a lot of my mum's friends were nurses as well. So yeah, that's kind of how I was brought up with it, and could see how much enjoyment and fulfillment that she got from it.
no, I
And
think
that's what made me want to go into nursing.
absolutely brilliant. So you said you were surrounded by a lot of people you know that were
Yeah,
in nursing. You were inspired by them.
yeah,
I think
absolutely.
that's brilliant. What would you say is the most difficult part of being a nurse?
Um, Sometimes it's knowing the right thing to say to somebody, um, especially when you're dealing with people that have, just lost a family member or have just been told that they haven't got long to live, or, it's really difficult knowing what to say sometimes. But sometimes there isn't the right thing to say. Sometimes it's just being there for that patient or that family member, holding their hand, just being with them.
Yes, and uh, I suppose that's something that's unfortunately become a sad reality. I guess more so because of well, the pandemic. I guess is
Yes, absolutely. But like I said earlier, the pandemic's made it a lot more difficult because the families aren't there with the patients. So all of this is over the phone. So beforehand, we could read a lot of body language, and we could, you know, hold the hand of the relatives, or, we're not able to do that at the moment. We're still there for the patient, but it's very different um, perspective when we're dealing with the relatives.
so. Of course, the pandemic has made it difficult. I guess because of course the relatives aren't there. I suppose. But what would you say? now that you've talked about the negatives, what would you say on the flip side would be the most rewarding? What are the positives that you'd say about being a nurse?
I love nursing. I think it's a fantastic career. Just knowing that you're there helping people all the time, and you do things without, they might be little things to us, but they mean such a lot to the patients and the relatives that you're helping them through. You don't realise, how scared people are coming into hospital and what impact that will have on them. And you just being there and comforting them has such a profound effect on them.
Yes, of course. I've heard about how, because me personally, I've wanted to pursue a medical career as well, and of course, I'm very well aware that these subjects can be very, very emotional for not just the patient, of course, but of course all the relatives. As I'm sure you know, of course, and
Yeah,
I suppose I know a lot of people as well who want to pursue medical careers, but I don't think they always just focus on like the knowledge side of things, but I think it's also equally important as well to um, know how to talk to people, how to build that relationship with a patient. I think, and
absolutely. And I think, during your nursing career, in terms of, at university, and, that's where you go to get the knowledge, but that can't help with your bedside manner and how you talk to people and how you interact with them. I think that comes naturally. And the people that it doesn't come naturally for, maybe aren't suited for that career.
yeah, I guess so. So actually, what this leads on nicely into the next question. I know a lot of people who have taken part in the initiative do want to pursue a medical career. Some of them do want to go into nursing. So, what advice would you give to anyone who wants to become a nurse in the future?
Just think, follow your dreams. It's a fantastic career. It's something that you don't have to go into straight away. It's very good, and you can join it later on in your career. So I know a lot of people are older when they join. Myself, I was younger. I did my GCSEs, my A levels, my degree, and went straight into nursing. It's very family friendly. I know that sounds peculiar, but we work in long shifts, but I work 12.5 hour shifts, and I do 3 days a week. So I've got 4 days a week at home with my children and my husband. Um, the career choices along the way, all the things that, working in such a big organisation is really important as well. It's the teamwork in the hospitals and the NHS is fantastic. Being a nurse or being any medical career that you choose, you're just one very little clog in a very, very big wheel. And it's really important that, we feel that we are one and we all work together. And that's very beneficial, knowing that other people understand what you're going through and are there to help you as well.
So I think that's absolutely amazing to hear, and I think not just me, but I think everyone who is listening, we all want to thank you, people like you, for the absolutely amazing job that you're doing. We're all rooting for everyone in the NHS, who, of course, they're protecting us. They're on the front line from this pandemic, and I think, especially because today is International Nurses Day as well, so I think people are going to be reflecting on that even more today. So, on behalf of all the young people, I'd like to say thank you for what you're doing, and we are all rooting for you in this pandemic.
Well, thank you very much, and thank you for promoting nursing, because like I said, I think it's a fantastic career, and you've got the job security, and it's just something wonderful to go into, and I'm very passionate about my job.
Is there anything else you'd like to add before we end the interview?
I'd just like to say one thing, if I may. Just
Okay.
at the beginning, I was talking about PPE.
Yeah.
I didn't say there was a lack of PPE.
Uh,
I want to make that clear, that we all have to wear PPE to keep ourselves protected, and that's very important. And there hasn't been a lack of PPE where I work anyway.
I
We've
think
been
it depends
very
on
lucky.
the area, I guess, like which hospitals or which.
Yeah, absolutely.
Okay. Well, sorry for mishearing.
No, that's okay. That's okay. I just wanted to clarify it.
That's fine. Yeah. All right. So thank you very, very much. And yeah, that's it.
It's a pleasure, and thank you for everything you're doing as well.
Thank you very much.